Let's talk about why we wanted to include cupping in our neuro release treatment course. When we look at cupping, it's been around a long time. It got really, really popular in the Olympics with Michael Phelps and some of the other swimmers, and we started seeing these marks everywhere, and that brought a lot of positive as well as negative press. And the reason we think it's so important to use is that from a manual therapy standpoint, it's one of the only things that we have that applies a negative pressure or distraction to the system. Most of our other manual therapy techniques are compressive in nature. So when we talk about our neuro release treatment and looking to affect the nervous system and sensory system to alter pain, we need to have the option to provide different types of sensory experiences. For some people, they're going to like compression. For others, that's going to feel threatening. And in that scenario, I need to be able to add distraction. So say what you want about traditional theories of why cupping works. Ultimately, it's going to change the sensory input to the system through distraction, as well as we're going to see microvascular and circulatory changes, which might be related to some of those neuroimmune responses and some of those neuroinflammatory responses related to peripheral nerve hypersensitivity and pain nociceptor hypersensitivity. If we can change that sensory input through distraction or through changes in local circulation, we can have an effect on somebody's pain. If we can affect somebody's pain, we can change the way they move and hopefully improve their outcomes so they can get back to doing what they love doing. So we hope to talk to you about cupping and more in our neuro release treatment course, looking at this idea of neuroinflammation and sensory input, whether we're using cupping, percussion, or instrument-assisted massage. We want to have options in providing manual therapy care to have the best outcomes for our patients.